Now, the next classification of ADR is according to its nature. So we have types of ADR from A to F. Type A, augmented. Type B, bizarre. Type C, continuous. Type D, delayed. Type E, end of use. And type F is failure of therapy. So let's start with type A. Type A is augmented. It has a subtype called extension effects and side effects. So type A, when you say augmented, there is a profound or enhanced therapeutic activity. It can be dose related or dose dependent. It is reproducible and it is the most common type of adverse drug reaction, and that makes it very predictable. So the subtype is extension effects. This is related to pharmacological activity of the drug. It is also called as exaggeration. We have unwanted increase in the intensity of effect. This can be attributed to overdosage that result to excessive action. For example, hypoglycemia can be experienced if a patient takes too much of the oral sulfonylureas or insulin. Tachycardia that can be experienced from albuterol. Diarrhea from prolonged use of antibiotics. Sedation from prolonged use of CNS depressant. Bleeding from prolonged use of anticoagulants, and cardiac arrhythmias also from digitalis. Another example or subtype for augmented is the side effects. Side effects are unrelated to pharmacological activity of the drug or the undesired effect. It is unintended but usually an avoidable effect. This is secondary to pharmacological effect of the usual drug doses. So your opiates in the usual drug dose, it can cause constipation. Also nitroglycerin in your usual dose, it can cause headache. And the ACE inhibitor, commonly, it is attributed to produce cough. Also minoxidil, its side effect is hypertrichosis. That's why we have also minoxidil shampoo which utilizes the side effects of hair growing activity. Now for your type B, which is called bizarre, it is uncommon, rare, unpredictable. It's not dose related or dependent. It's not reproducible. You have no relationship to pharmacological action of drug. It is often serious and fatal. So we have two subtypes, idiosyncrasy and hypersensitivity. So idiosyncrasy or idiosyncratic reaction are genetically determined reactions. These are rare, abnormal, undesirable, and unexpected genetically determined drug effect. There's no mechanism of action. An example of that is if if the patient has genetic polymorphism, if then a patient takes antipsychotic agents, or we can have halothane, succinylcholine, it can experience malignant hyperthermia or very high body temperature. Another is idiosyncratic reaction with carbamazepine, phenytoin, sulfonamides that can produce Stevens-Johnson syndrome. Hypersensitive reaction is also another type of bizarre reaction. It is under immune responses to environmental antigens, resulting in symptomatic reactions upon secondary exposure to the same antigen. So these are immunologic reactions to the drug. Okay, these immunologic reactions have different subtypes. So we have type 1 hypersensitivity reaction, type 2, the type 1 is called anaphylactic immune response, type 2 is called cytotoxic reactions, Type 3 is immune complex hypersensitivity, and type 4 is cell-mediated or delayed type. So for type 1, an example for immediate or anaphylactic immune response, this is the most common category of allergic reaction. An example is allergy to penicillins. Yeah. Hay fever or anaphylaxis, or it can produce asthma or urticaria. For type 2 cytotoxic reaction, an example for this is blood dyscrasias. For example, hemolytic anemia that is produced by methyl dopa. We can also have aplastic anemia that is produced by chloramphenicol. The type 3 is the immune complex. So another example for this is the serum sickness or the Arthur's reaction. We have also systemic lupus erythematous reaction from hydralazine. And then followed by type 4 or the cell-mediated or delayed type reaction. An example for this is our contact dermatitis with poison ivy and also organ and tissue rejection. Okay, for the next ADR, we have type C or the continuous. This is uncommon, but it can be dose and time related. So, associated with cumulative dose of the drug or long-term effects. That's why its subtypes are addiction, dependence, and tolerance. So, addiction is a condition where a person takes a drug compulsively despite potential harm to themselves or their desire to stop. An example of drug that can cause addiction or patients or people are addicted to, we have marijuana and opiates. Dependence, in the other hand, is compulsion to take the drug repeatedly and experience unpleasant symptoms if discontinued. Undesirable condition induced by drugs involving tolerance, physical dependence, or psychological dependence. So an example of drugs that can cause dependence are benzodiazepines, caffeine, cocaine, nicotine, opiate, and opioid narcotics. So dependence can be physical dependence. It occurs when a drug has been used habitually and the body has become accustomed to its effect. The person must then continue to use the drug in order to feel normal, or its absence will trigger symptoms of withdrawal. That happens with the use of cigarette smoking or nicotine in the body. Another type of dependence is psychological dependence. This occurs when a drug has been used habitually and the mind has become emotionally reliant on its effect. So it needs the drug, or for example, it needs cigarette to elicit pleasure or relieve pain, and does not need or does not feel capable or functioning without it. Tolerance is the reduced effect with repeated use of drug. So you can develop tolerance if we use higher doses of the drug that produces the same pharmacologic response. So that's why, for example, morphine, if the patient take morphine almost every day, it can develop tolerance to it and cannot experience analgesia even though in a higher dose. Amphetamine, barbiturates, atropine, and nicotine also can produce tolerance. The next type of ADR is the delayed or type D. It is manifested long after drug exposure. And an example or subtype is the carcinogenicity and teratogenicity. So carcinogenicity is ability of any substance to cause or induce cancer. An example is our anti-neoplastic agents, heterocyclic amines, aromatic hydrocarbons, nitrosamines, and also have aflatoxin. Teratogenic substance, on the other hand, these are drugs or medications or chemicals that can cause congenital malformations or birth defects. So for drugs, we have teratogenic drugs, example, is carbamazepine and valproic acid. So these two drugs can cause neural tube defects. We have also diethyl stilbestrol that can cause developing vaginal adenocarcinoma after puberty. Phenytoin, on the other hand, can cause fetal Hydantoin syndrome. And then streptomycin can cause ACE nerve damage to our baby. Tetracycline can produce discoloration and defects of teeth and altered bone growth. Thalidomide, that is why it's not used in the market right now because it can cause phocomelia. And also isotretinoin, which is component of our whitening facial products. So isotretinoin should be avoided, or these facial products should be avoided by mothers because it's a powerful teratogen. The next type is our type E, or end of use or withdrawal. This is uncommon. It's a withdrawal symptom generally occur shortly after stopping the drug and results from termination or sudden discontinuation. So for example, there is opiate withdrawal. So you have to taper down the use of opiate because it can cause withdrawal. We also have rebound insomnia and excitation if we suddenly stop benzodiazepine. Rebound hypertension if we suddenly stop clonidine. Rebound decongestion if we suddenly stop nasal decongestant. And adrenal crisis for steroids in a patient with Addison's disease. Now type F, or failure of efficacy or failure of therapy, these are unexpected failure of drugs. So this is common, dose related, and may result from drug interaction and incompatibilities. Or if a patient use counterfeit drugs or substandard drug. Failure of therapy also arises most especially in patients' non-compliance or inappropriate use and wrong route of administration. Also, drug resistance that's developed, for example, in antimicrobials. We also have underdosing of drugs, manufacturing errors, or we have consumption of expired medications or medications that are improperly stored in the pharmacy can cause failure of therapy. So these are the different types of our adverse drug reactions. Thank you so much for listening.